Hello, so this video will be talking about the issue of mental health for the helping profession. So first, let's start with the question of what is a helping profession? So a helping profession means literally a profession that involves in helping others. It involves helping a person either physically, emotionally, intellectually, or even spiritually. There are many jobs that is considered as a helping profession. Some of the examples of helping professions are people who work in public health sector, mental health sector, criminal justice, social workers, and human services sector. All of these sectors are very broad and can include your doctors, nurses, police, orphanage worker, disaster relief worker, and many more. Our frontliners who are actively battling against the spread of COVID are also part of helping professions. However, this video will mainly be using the public health sector as an example. As we all know, mental health is very important. Our mental health affects how we think, feel, and act. It will then affect our normal functioning, which then would lead to affecting our job. Having persistent poor mental health would lead to depression, anxiety, and major stress. If a person who has poor mental health were to work in a helping profession, then his mental health might be affecting the people who he should be helping. So instead of helping them, he might be prolonging their problems. There is always a warning sign for everything. Some of the early signs for when you have a poor mental health are you are eating or sleeping too much or too little. You feel like you're always tired or have no energy. You stop doing things that you used to enjoy doing. You start avoiding others for no particular reason. You start experiencing severe mood swings without any explanation. And feelings of helplessness or hopelessness with persistent negative thoughts are one of the early signs. Experiencing some of these for a short time is not a cause for worry yet. However, if you are experiencing it for a prolonged period of time, you need to start considering to seek help. Some of the benefits of having a good mental health are that it will lead to an increase in productivity, increase in work quality, and will lead to us developing better coping mechanism. A person who works in a helping profession that has good mental health would be more capable on helping others and can provide the utmost care on others. So why is this topic being brought up now? The answer to that can be found when observing the current events of the world. People who work in helping professions are heavily included in all of the shown events. This shows that people who are in helping professions are an important part of our society. They are busy with helping others, but who is helping them? Many helping professionals are suffering from anxiety, stress, and depression due to the nature of their work. They are also humans who have personal lives as well, and some of them are even having problems with their personal life. Some of the things that they experience through working can also be traumatic, and all of this would cause quite a number on anyone's mental health, not just helping professionals. There are many websites, articles, and journals that are talking about how the mental health for people who are in the helping profession are poor. These are just some of the most notable article headlines from WebMD, American Psychological Association News, and Forbes. Psychiatry Advisor has released an article on January 2019 reporting that there are high rates of burnout and depression among medical practitioners. There are also 30% of psychologists who have felt suicidal and 4% who have made suicide attempts. And according to a study among 1,000 counseling psychologists, 62% of them are depressed while 42% of them have depressive symptoms. This is a very high number considering that counselors are the ones who should be helping others to treat their depression. The question is, why is the number so high? Why does it happen? So based on a study by Mark and Smith 2011, excessive job demands and overcommitment is a major contributing factor towards anxiety and depression. This is especially true to nurses and doctors. However, the thing that is stopping them from seeking help is the stigma related to seeking help, especially for therapists and counselors. Although it is lesser now than it was before, there is always a stigma for seeking help. Even mental health professionals are not free from stigma to seek help. The first stigma is among doctors, which is the us and them mentality. The us meaning people who are helping others and are the healers. And if you are ill, you should not be one of us, and instead one of them who are ill. And you should not be practicing psychology, psychiatry, or counseling. Next is the fitness to practice stigma, whereby if they are suffering from depression or poor mental health, then they should not be in this practice. The general stigma of it would then be they must have done something wrong to cause it, or isn't qualified to be a psychiatrist, or that they should have gotten more training. That is why they are suffering from poor mental health. However, this stigma is especially wrong and is especially harmful for psychiatrists who are experiencing poor mental health. Another one is due to licensure concern. Many physicians and psychiatrists do not self-disclose due to a worry of being sanctioned by licensing bodies. A study among 5,000 physicians have found that nearly 40% reported that they would be reluctant to seek formal medical care for treatment of a mental health condition because of concerns about repercussions to their medical licensure. Their concerns are very well justified because there have been cases where doctors have to fight with licensing officials after they have self-disclosed on their mental health issues. Currently in Malaysia, the helping professionals are busy handling with the situation of COVID-19. Some of them have reported of having stress, anxiety, and even depression. This is because even staff from the health ministry have tested positive for COVID-19. So they are also wondering if they will get infected by it and end up infecting their loved ones of it. The Malaysian government, however, have taken appropriate steps to ensure the mental health of our helping professionals by establishing hotlines and allowing appropriate rest hours to prevent any mental health issues as well as burnout.
Having a healthy mental health is important in the helping profession. However, there are workers mentally impacted while helping others, especially during the recent pandemic of the COVID-19. I held an informal interview through Twitter with a doctor who was working as a frontliner for the pandemic at a local hospital in the Philippines. I asked her if she knows anyone in the helping profession experiencing any mental health issues such as anxiety when treating COVID patients, and she responded that the anxiety mostly comes from selfish reasons such as what if we get infected or infect our family. She also mentioned some personal reasonings. Besides that, she also mentioned that the despair is also weighing heavily because we know that this is not ending anytime soon. We're running out of personal protective equipment. Everything we use is makeshift now, so the fear while interacting with patients is stronger and can lead us to make poor decisions. A podcast called Public Health on Call was held by Johns Hopkins Bloomberg School of Public Health, where they interviewed Dr. Albert Wu, co-director of RISE, which is Resilience in Stressful Events. A snippet of the podcast can be heard here.
Thank you, Dr. Wu, for joining me. I understand you've been studying the mental health of caregivers for some time now. Could you tell me a little bit about that?
Sure. Well, I'm an internist. I'm a general internist. But I've always been interested in how, in particular, stressful incidents in the hospital affect healthcare workers, doctors, nurses, and in fact, all the other many people who work in the hospital. And we found that when bad things happen, which happens quite frequently when people are sick and you're trying very hard to make them better, that those healthcare workers are often traumatized by the same incidents that cause patients harm. And they can become very depressed, anxious, sometimes fearful, feel like they hadn't done everything that they could have. And this can actually hamper them in their work, both in their personal lives and in their ability to do a really good job of taking care of patients.
Wow.
Sort of a principle we've worked on is that healthcare workers need to be healthy, both physically and mentally, in order to do their best job taking care of patients.
Which brings us to the unprecedented situation we're now facing with the coronavirus. What do you think the key issues are for healthcare workers and their mental health right now?
Well, the key issues now are a few. First of all, as you said, this is really an unfamiliar situation for healthcare workers. They're rarely in a position where they themselves are at risk. There's also just not enough information. People just don't know what to expect, and they're afraid. Healthcare workers are worried about their patients who are desperately ill, and it's frightening to see people so ill. They also are afraid that they themselves may become infected. If they do, they're afraid they may go off and infect their own family members or other people that they care for outside of the hospital. And in many ways, they feel frustrated because we've had a shortage of supplies. And they feel like they're not being given all the tools they need to do the job, the very difficult job that they've been charged with doing. All of this makes what is already a very stressful work environment that much worse.
And aside from the obvious risk of actually getting sick with coronavirus, what are the other consequences of that kind of stress?
Well, the other kinds of stress are that people may simply not be able to, people may have trouble sleeping, they may be anxious, they may feel like withdrawing actually, and they may not have as much reserve as they would normally have for taking care of people, for giving the kind of compassion and caring that patients need so much when they're sick in the hospital.
However, even without the pandemic, workers can still be mentally impacted. An informal interview was done through WhatsApp with an Indonesian doctor currently working in Germany, where she stated that she had always experienced distress every time she handled difficult cases in ER. She stated, "At the beginning of my career, I always have anxiety every time I was going to ER for night shift. When asked if it was because of the fear that the patients' lives depended on her, she responded, "It's fear of doing something wrong." She also said, "Death is always difficult even though I've experienced it a lot. Like for example, I was working in a hospital which mainly treated breast cancer patients. I knew some of them were at the end-stage disease and they were gonna die soon. Even though everyone knew that we couldn't do anything anymore, it was hard to deal with death of patients because it's sad. The patient's family is sad. I don't know, anyone with empathy would also feel sad. And when I made a bad decision, I reflected on it even after the shift ends and felt like a failure and just cried even though it wasn't a fatal decision." She also stated that sometimes the specialists were unreachable at night because they were asleep, but then I needed quick response. This also contributed to anxiety and also one of the reasons why I hated night shifts. Sometimes they were even mad at me for calling late at night. That gave me even more stress. These are the things that make me depressed sometimes. Despite all the distresses, these healthcare workers had found some ways to relieve their stress, especially during the pandemic. An article was posted by CNBC in which they mentioned that medical professionals have been doing TikTok challenges and dancing to keep their spirits up amid coronavirus chaos.
Next is Related Theory, Job Demands Control Model by Robert Karasak. In this model, workplace stress is a function of how demanding a person's job is and how much control the person has over their own responsibility. Job demands represent the psychological stressors in the work environment. These include factors such as pace of work, time pressure, amount of work, conflicting demand. First, the employee's control over their tasks and how those tasks are executed. It consists of both skill discretion and decision authority. Skill discretion, use of one skill, variety of work tasks, and opportunities for learning. In easy work, concern about freedom to use one's skill and abilities. Decision authority, the individual's freedom to make decisions about how or when to do their own job. Job demand control model in a diagram. The horizontal axis shows the job demands, while the vertical y-axis shows the job decision latitude. Based on the diagram, there are 4 categories: low-stress job, passive job, active job, and high-stress job. Low-stress jobs, the combination of not very demanding tasks and control latitude for the employee. This section includes the most routine job. Passive job. These jobs are simple jobs with little to no decision latitude. This includes a lot of repetitive and production jobs. The risk of stress for this type of job is lowest. Active jobs. These jobs are highly demanding jobs that allow the employee to decide when to do the work. As the result of the high level of decision latitude, the person does not experience the job as stressful despite it being very psychologically demanding. High-stress jobs. This refers to very demanding or complex jobs with very little control. The employee has no control and has to do as he told. Risk of stress is very high for this type of job. Helping profession is a high-demand job, but with limited amount of decision latitude or control. The helping profession cannot simply decide how or when to execute the task like other jobs, and this profession has to think the skill that can be used without violating the ethics code.
So then, how do we overcome the rising numbers of poor mental health among helping professionals? So we can start by addressing the main causes of their poor mental health, which is, as stated before, excessive job demands and overcommitment to work. Excessive job demands not only will take a toll on helping professionals, but it will take a toll on anyone. So excessive job demands usually happens due to lack of staff or lack of expertise, which is then easy to overcome by hiring more staff and more experts, and rotating monotonous tasks will also help with reducing the feeling of excessive job demands by making the job less boring. Giving appropriate pay to their job will also reduce the feeling of excessive job demand because they will feel like all of their hard work is getting rewarded. Extending break hours will also help with relaxation, which then reduces burnout and will help with their mental health and stress. Next is overcommitment. An overcommitted person would take on excessive workloads while expecting more control and more rewards. The problem happens when their expectations of having more control and rewards does not deliver. However, they cannot just stop working or stop overcommitting because people in the helping profession especially will have no choice but to overcommit in order to help others and provide adequate treatment to them. Organizations and institutions, however, can help reduce the burden of helping professionals by introducing a few benefits or rewards that they were expecting to get. For instance, they can start by increasing the pay of their workers depending on the job they do. They can also offer paid vacation depending on the contribution of the workers to avoid burnout. It can also help reduce burnout by providing helpcare at home so that when they get home, they don't have to do any chores and they can just relax. An annual counseling session would also be very helpful to everyone as it can help by reducing stigma by normalizing a meeting between a counselor and the worker. It can also help prevent burnout and compassion fatigue for a worker, especially those in the helping profession. But a surefire way of providing rewards to their workers is definitely by asking them what their workers prefer as a reward. This would then make the reward more effective as they get what they wanted. Now that we have reached the end of the video, let us conclude the video by showing the main takeaways you should get from the video. The first lesson you should get from the video is that helpers need helping too. Everyone in the helping profession are sacrificing their life and time for others, but they are often taken for granted. Well, the general perception is that they are helping others, so they should know how to help themselves. This is very wrong. We all should learn to be nicer and to be more appreciative to our helpers. The next lesson you should get is that mental health is important to everyone. Because what if law enforcers are experiencing burnout? What if they see a crime happening but they are too tired to even care? What if doctors misdiagnose a patient due to their poor mental health? The patients might die from the misdiagnosis. It's okay to not be okay, you just need to seek help to be better. The last lesson is that we should appreciate our helpers more. Helping profession is a very noble profession. They put others first before themselves. They are sacrificing their life, and the least we can do is to show appreciation to them and to treat them better.